Hello, my name is Bethany Nelson. I'm a registered nurse at Christus St. Patrick Hospital in Lake Charles, Louisiana. I'm attending the baccalaureate program at Lamar University, and this is my capstone and 5-year plan. I obtained a bachelor's in general studies with a concentration in arts and humanities from McNeese in 2007, after I attempted to complete the bachelor program at McNeese but was unsuccessful. But I was not leaving college with nothing, so I got my bachelor's in general studies. I worked in a hospital as a telemetry tech and a secretary for about a year or two, and was ready to go back to school and went and got my LVN LPN from Lamar State College Orange and graduated in 2010, where I continued to work at St. Pat's. I stayed at St. Pat's, and at that time we were required to work 1,000 hours before we were able to go back and get our RN. So then I worked my 1,000 hours, went back to Lamar State College Orange and got my associate's degree in nursing, and I'm now attending Lamar University to get my bachelor's. I have been on the same cardiac step-down unit since I was a tech, and I was hired in 2008 as a tech. I went to the LPN, and then I was an RN, and I'm currently an RN on that unit. Our unit requires us to be ACLS, BLS, and EK interpretative qualified or certified. We have to maintain those certifications. So, first off, learning objective 1, humanity and society construct. Practices safe and effective holistic patient-centered care to a variety of patients, clients, in multiple settings from a global perspective by incorporating theories and evidence-based findings. The assignment that I felt like met this objective was the holistic theory and the holistic theory-based nursing process from the class Nursing 4316. During that assignment, I discussed a patient having chest pain and the care plan that I have actually performed with patients that have chest pain or having active chest pain. With this particular patient that I was using, we talked about the particular causes of his chest pain, and what I was going to do to relieve it, i.e. the nitro, oxygen, morphine if necessary, and the things that I would do to determine if I needed to alert the MD on call, which was the EKG. Also just assessing the patient and continuing that. I feel like that definitely was patient-centered, and I assess and monitor patients with chest pain from all walks of life and who are having an array of symptoms that don't always mimic one another. The second learning objective and third, lifespan health continuum construct. The objective 2 was supports patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Objective 3 was evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. I felt like practicum reflection 1 through 4 addressed these objectives, and I feel like I met 100% of that. This particular assignment, I talked with a very dear friend of mine who had breast cancer, and fortunately she is in remission, and she had a very detailed and specific plan of care for herself that is still in place today, that she continues to see her physician for. And she also did have a mastectomy, and post mastectomy had some issues, and discussing with her plan of care and the things she can continue to do and the things that she did, I feel like meets these goals for promoting and restoring health and maintaining wellness. Next is learning objective 4, evidence-based practice and clinical reasoning. Synthesizes clinical judgment in nursing practice utilizing critical thinking, nursing process research, and evidence-based practice. In this nursing 4620, care of the patients with compromised multiple health states, discussion 2, evidence-based guideline or protocol. I talked about a evidence-based guideline, target BP, which is significant to my unit, especially because we constantly monitoring blood pressure for an array of issues, and I've commented and discussed some of the things that we actually practice in my floor, and some of the things I felt like we could change. So I felt like I met that goal at 100%. Learning objective 5 and 6, employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. And number 6 was differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients' clients as a member of this healthcare team. Again, in 4620, we talked in Practicum Reflection 2 about Mrs. B's plan of care and how it was specific to her requirements and or what she was willing to do and willing to not do. I feel like throughout our discussions we talked about the typical treatments that people undergo when treating breast cancer and what she was going to do, and I feel like that met that goal 100% during that assignment, or met that objective. Number 7 was demonstrates professional integrity, effective communication, active inquiry, and service to the community, and I felt like in nursing 4550, leadership and management, effective leadership and qualities paper, and the practicum assignment, clinical application, I extensively talked about the professional integrity, communication, active inquiry, all the things that it takes to be a leader and be effective in that leadership role, and all the things I felt were important to have as a leader in dealing especially with the specific scenarios that we deal with. So I felt like that assignment met that goal. And finally, my 5-year plan is I'd like to graduate with my BSN this year. Our unit is going to be remodeling some of our rooms to be true step-down ICUs, so I would like to obtain my CCRN just to have that. And then in 2021, get my cardiac vascular nursing certificate, which is a little less specific. I also would like to side note and train in a whole different field with labor and delivery, and then NICU maybe the next year in well baby, as I did my preceptorship for my ADN on a labor and delivery unit, and I really enjoyed it. So that may be in my future. Thank you for listening to my presentation, and have a lovely day. These are my references.